Welcome everybody to another video. This time I'm joined by Kennedy Odero. Kennedy is the project manager for our VIP project in Kenya. So this time we're really focusing on one specific project, and I leave it to Kennedy to introduce himself and then also explain what does VIP actually stand for. So Kennedy, do you want to take it from here?
Thank you, Dr. Reina, for first inviting me into this. As you have said, my name is Kennedy Odero. I coordinate the Vision Impact Project in Kenya. A Vision Impact Project is a 4-year project which is running from December 2021 to December 2025, being co-funded by BMZ in 2 counties and CBM, all funds in 5 counties. Vision Impact Project's goal is improving delivery of quality eye health services through strengthening health systems across primary, secondary, tertiary, and tertiary levels in 10 counties in Kenya. So the project is supposed to cover 10 counties, which is quite significant in the country.
So tell me a little bit about the financial volume of this project, because when presenting a project on one of these videos, obviously it has a specific reason. You already alluded to this, that you want to cover up to 10 counties in Kenya. What's the financial size behind all of this?
First, I would want to thank the leadership for having given the Kenya County Office this opportunity. Vision Impact Project is totaling to about 17 million euros.
So you thank the leadership for giving the Kenya Country Office this opportunity. That obviously also works the other way around. We are not doing this kind of with a blindfold on. We know that we have high quality staff and a high quality team in Kenya. So it's well deserved and well earned that the Kenya Country Office can implement this project, which is of significant size, as you say. So, and what specifically are we doing there now in the VIP, in the Vision Impact Project?
Thank you. Well, I want to probably begin by because you have talked of the expansive nature of this project. I want to underscore the fact that it is quite multisectoral, because we are involving ministries of health, Ministry of Education, and Ministry of Public Service, where social protection is anchored in. And this has given it a mandate because there are various players that are coming on board to ensure service is delivered comprehensively. And the project is targeting health system and strengthening, it's targeting inclusive education and social protection, which is key to the delivery of such a magnitude of project. Besides this, we are partnering with 9 both local and international organizations, and we are doing this through coordination mechanism where the 9 come together for service delivery in areas which are quite structured. We have planned this, or rather programmed this, to take care of demand, supply, and governance structures of the project through peak technology. Under demand, we are focusing on demand creation through data generation for evidence. And in this project, we are going to have a rapid assessment for avoidable blindness in all the 10 counties that we are going to have the project. Besides that, we are creating awareness in the community, through the communities and schools. And we are using the robust system in Kenya, that is through community health strategy program, and also the schools, to spread the information about eye health. This alone will create more interest in eye health services across the country. And also through peak screening, we find that majority will come to know their eye conditions and will really be urged, or rather encouraged, to seek for eye services. Again, under the supply side, we are looking at infrastructure improvement, where we'll be constructing some eye units. We are looking at equipping facilities in readiness for service delivery, because once demand is created, there'll be a surge in eye health service need, and therefore we are equipping facilities and also training health workforce specifically on eye-related cadres that will provide service to these particular service requirements. On governance, we are looking at strengthening coordination of eye health services across the countries and even with the national government. We are looking at having establishment of eye health technical working groups that will coordinate and provide technical oversight in the implementation of the project across board, and also stakeholder engagement and meetings just to ensure the stakeholders' ideas and program priorities are taken into account as we implement. And besides that, we're also going to have joint support supervision with the Ministry of Health officials to ensure quality is enhanced. Thank you.
So that is very interesting how you describe it, because you cut the problem in different layers, and you're addressing the issue on this layer from school screening and then really working up to national policies. Another dimension that you just described is you're using the RABs, the Rapid Assessment of Avoidable Blindness, to create a baseline to understand, so what is the issue in what county? And then you're putting the screening peak as the screening tool on top of this, on this baseline that you created. But then obviously something needs to happen with the data, because you do the screening with the mobile phone. Explain to me more about what happens then with the data and how is that progressing?
Well, through peak technology, we are going to collect data right from the screening sessions, that is at the community and also at schools. And this data already, the government of Kenya has signed a data agreement with PIC, which is going to allow for data sharing and use. And so through PIC system, we are going to have layers of those who can access the raw data and those who will accept the finished product. And so CBM will be given the finished product in terms of numbers that are being seen, numbers that are being screened. And this data is going to be very useful, especially for decision making in regards to programming.
And I think it's really important to understand that the peak acuity as the front end tool, as an app on the mobile phone, is then linked to this back end of the capture database, or the peak capture database, and that this enables us to really track the patient flow. We can see by individual how people move from one stage of screening to triaging to a treatment, if that can be done at a primary or secondary level, and then up to treatment at tertiary level. And we can exactly see how many people actually fall out of this process, because patient compliance, patient adherence to this process is a big issue. And I think it's a major achievement that you have now reached this agreement with the Kenyan government, because data protection is all over the place. And here in Germany, that's a huge topic. So it is a major achievement that we can actually collect this data, which is patient data, which is super sensitive data, collect this data, manage the data, and still have the trust of the Kenyan government that this data is secured and protected, and that they know exactly what's happening with this data, even though the data is physically kept outside of Kenya as a country. So I think that is a major, it's a prerequisite for this project, and it's a major success that the Kenyan government has this trust in the work of the CBM in Kenya. So that's really good. Excellent. What do you see going beyond this project? So you said we're doing school screening, we're also doing community screening, we are capturing the data in hopefully up to 10 counties, but there's more counties in Kenya. What will happen next? What is the long-term effect beyond the project itself?
Thank you. With the implementation of Vision Impact projects in Kenya, we see a lot of benefit coming into the country. Because one, as we all know, there have been challenges that eyesight has come across, and this is actually affecting real life of the Kenyans. And so beyond this project, I look at us having improved quality of life of the beneficiaries. For those who don't do, or rather do their daily activities on their own, through this, some of them will have to continue with improved quality of life. Despite the fact that they had challenges in the health system, I also believe that once this project is implemented in country, there's going to be strengthened healthcare system to contribute towards the government agenda of universal health coverage, and that is a plus to the country. In addition to that, there's also better education outcomes that are going to come as a result of this, because one of the focus areas is to improve or rather have model schools for inclusive education in each of the counties. So those learners with visual impairment will definitely have better education outcomes.
Yeah, I think that's a super important point because it points to the fact that eye health is not only a health issue, but eye health has, and for us in CBM, that's pretty clear, but sometimes other people not directly linked to this topic, dealing with this topic, it's sometimes they don't see the ripple on effect of a visual impairment, and that has a very broad effect on achievement in school, the opportunity to get a job, to earn livelihood, to support a family. So eye health is really key in development work, and it can be really a game changer for the individual. Now, we discussed this big project, huge project, very complex project, Kennedy. So complexities on these different levels, the technical levels, the political levels, going into schools, going into communities. So it's a very complex topic. And you know that we are driving this program management pathway program as a training program for our project managers and project officers. So we want to ensure, we want to support our staff to become better project managers. Now, you already have one of the most complex and largest projects that we ever had. What qualified you? So what could other people learn from you personally if they want to get into a position of managing such a huge project at some point in the future? You just share a little bit about you and what brought you there where you are right now.
Thank you for that question. It's quite interesting. I owe this to my previous experience. I have worked in USAID Centers for Disease Control, coordinating emerging infections programs, and also for the USAID funded projects. I was in charge of HIV programming. And this has given me adequate skills. And of course, being in CBM for the last 1 year or so has given me added skills that equip me to manage this project. I can say that it requires a lot of skills in partnership formation and management, including consortium, because you realize that in this project, we have about 9 partners, and they are all delivering to the key research areas. So it is really important for someone to have skills, and this is one of the skills that I've acquired over time. On how to just manage groups and also consortium and partnerships. Besides that, there is the need for understanding the intricacies around managing programs and implementing programs where the government is involved. A lot of it is based on soft skills on how to manage the government colleagues and their expectations. And this is something that has been of great help over time for me as I implement this program. I have also have to appreciate the fact that it requires a very strong organizational skills and planning. When you are planning for this project, it really had to be well thought, and therefore it requires good planning skills, good stakeholder management capabilities and engagement, and also communication. That those are very important skills for this level of organization and also management of the project implementation. Besides this, there's also the focus on outcomes and not merely outputs. So we must see results at the end of it. So for performance management, and even as we interact with the partner staffs, we ought to understand what are our outcome indicators and what is the general observation with regards to our target achievement. So all these skills are quite important for one to understand the development that is going on in the program and also how we are focusing towards the end result. Thank you.
Cool. Excellent, Kennedy. Many thanks. I think we can continue talking about this project for the next 2, 3, 5 hours. I know that you already ensured high-level presence in Kenya TV on this project, and it's about an hour, almost an hour of a panel discussion on this project, which is amazing. Next week there will be the official launch of the project with participation of high-level government representation. I look forward to being there, seeing more of this project on the ground next week. So this will be very exciting, and I really wish you all the best for this project, which is not only a project, it's really a big program that you have to keep there together. So amazing work, and all the very best. And I think we have to conclude here. So many thanks for your participation today. And I would say goodbye to all our listeners, to everybody, wishing you all the best in the coming weeks. Take good care.
Bye. Bye. Bye, and thank you.